welcome to AMGA's Public Policy Update. My name is Chet Speed, Chief Policy Officer of AMGA, and I'm here with...
Hi, I'm Daryl Drevna, Senior Director of Regulatory Affairs at AMGA.
Again, thank you for being here. This is our seventh take. The last one went 6 minutes long. Our communications team says it's going to be 3. So, Daryl, how can that be?
We're
talking Medicare regulations.
E&M codes, conversion factors in 3 minutes.
I tell you one thing, we're going to go as long as we want.
Exactly.
Because this is Medicare regulations.
This is...
So speaking of regulations, yesterday AMJ submitted its comment on the Medicare Physician Fee Schedule.
Right.
What were some of the key issues that we talked about?
Sure. So one of our key points that we hit on our letter was the change in Medicare Conversion Factor. CMS is proposing a 3.75% cut. And this is due to a lot of factors. They're continuing to increase support for primary care evaluation and management codes. And so due to budget neutrality rules, they need to rebalance things. And also Congress is, at the end of last year, passed a 3.75% increase to help offset some of the disruption due to COVID. That's expiring at the end of the year. So due to that, our members are facing a 3.75% cut in the conversion factor as of January 1 of next year.
Yeah, that's a pretty dramatic cut. So just a couple things. One, there's sort of a real discrepancy between how much some specialties are being paid under this fee schedule versus others. Can you
Sure.
get a little light on that?
Yeah, I hit on the budget neutrality a minute ago, and there's this big swing. So like portable x-rays, a plus 10%, radiology, minus 9%, oncology, minus 5%. And these are aggregate, right? So depending on what your practice looks like and that sort of thing, it's going to vary based on your specific things. But in the aggregate, you're looking at some very big swings in the allowed charges and what the final payments are going to be based on your specialty.
Okay. So given the fact that our members are multi-specialty, there's some real leadership challenges in terms of basically making sure that all specialties and primary care physicians are taken care of, as well as the APPs.
That's correct. That's correct, yeah.
And so one more thing before we end, because we have 3 minutes, remember what I said before? It's not just a 3.75% cut because of the fee schedule. We have almost 10% of cuts coming on January 1st of 2022 because of a PAYGO issue in an earlier COVID bill in March, and the sequester, which had been eliminated through 2021, is back in force. So that's 10% total. What's AMJ doing about that, and how can the members basically help us help them?
You're right. So I hit on this in our letter to CMS, and look, there's this conversion of cuts coming, so CMS, use your authority to try to get rid of this conversion factor. So that's what I'm doing on the regulatory side. But our colleagues on the lobbying side of the team are working with members of Congress and their staff so they understand that these cuts need to be addressed before they go into effect next year. And one of the things our members can do to be a part of that is to take advantage of our district advocacy program, and our team here will help set you up with a member of Congress and their staff so you can tell your story, what these cuts would mean to your practice, what these cuts would mean to your patients. So ideally, in an end of the year package, Congress will move to ensure that these cuts don't get implemented.
All right, great. Gerald, thank you. And again, we encourage you to contact AMJ's public policy team so we can help you with these Medicare cuts. And because we are limited to 3 minutes, stay tuned for our next session on MIPS value pathways. Thank you so much.
Thank you.